Welcome, behavioral health psychotherapists, clinical counselors, social workers, and psychiatry residents. Have you ever heard a client say, "I know I shouldn't have done that, but I just couldn't stop myself"? What's truly happening in that moment? The answer lies in the deep, ancient connection between emotion and action. This video will provide you with a clear framework for understanding the powerful, often subconscious link between emotion and behavior. We'll explore the evolutionary and neurobiological origins of this connection, offering practical insights into why emotions are not merely states we feel, but active, motivational systems designed to prompt specific behaviors. Understanding this framework is key to moving beyond simply identifying feelings to addressing the root causes of behavioral patterns. We'll outline the evolutionary purpose of emotion, the neurobiological bridge from feeling to acting, the predictable link between specific emotions and behaviors, and practical strategies for helping clients break unhelpful cycles. Let's begin by understanding why emotions exist in the first place. Emotions are not a modern invention, but an ancient system developed for survival. They served as rapid response mechanisms, guiding our ancestors to act in ways that preserved life. Think of fear, triggering the fight-or-flight response, or disgust, prompting avoidance of potentially toxic substances. Anger mobilizes energy to confront a threat or injustice. Even sadness signals a need for social support or prompts withdrawal to conserve energy for healing. Now let's bridge the gap between feeling an emotion and acting on it. The limbic system, particularly the amygdala, acts as the brain's emotional, alarm system. Crucially, the amygdala is directly connected to motor pathways in the brain. This means the emotional signal isn't just felt, it's immediately routed to areas that control movement and action. While the limbic system initiates this emotional behavioral response, the prefrontal cortex serves as a, regulator or brake. When the emotional signal is too strong, or the prefrontal cortex is compromised due to stress, trauma, or underdeveloped skills, the impulsive behavior is more likely to take over. The reward system, driven by dopamine, further complicates this. Certain behaviors, even unhelpful ones like substance use or binge eating, are paired with dopamine release, creating a powerful loop. Emotional state leads to behavior, which leads to reward, reinforcing the behavior. This explains why some behaviors become so compulsive. Let's look at how these emotion-behavior linkages manifest in common clinical scenarios you might encounter. With anxiety, the action tendency is escape or avoidance. A client with social anxiety might avoid parties, even though they want to go. The feeling of anxiety drives the behavior of avoidance, which then reinforces the belief that the situation is dangerous. For anger, the action tendency is often attack or confrontation. A client who feels disrespected might explode in a rage, damaging a relationship. Here, the emotion of anger leads to a behavior that creates further negative consequences. With sadness or depression, the action tendency is withdrawal or inactivity. A client feeling overwhelming sadness might stay in bed all day, avoiding social contact, which then deepens their sadness. Understanding this framework is the first step. Now, how do we apply this clinically? Encourage clients to see their behavior as a predictable response to their emotional state. This psychoeducation helps reduce self-blame and fosters self-compassion, paving the way for change. We break the cycle by first helping clients identify and label their emotions. Then, we introduce techniques that create a pause between the emotion and the action, such as mindfulness, DBT distress tolerance skills like TIP, or CBT behavioral experiments. The goal isn't to suppress emotion, but to find more adaptive behaviors. For example, instead of lashing out in anger, a client can learn to assertively communicate their needs. To summarize our discussion today, emotions are a powerful force for action. By understanding this deep link, we can help clients move from being too driven by their emotions to thoughtfully responding to them. As you work with your clients, remember to ask not just "how do you feel," but also "what does that feeling make you want to do?" This simple question unlocks deeper insight and more effective behavioral change. Empower your clients to become the masters of their own actions, not just victims of their feelings.